A new warning today from the Surgeon General about teens, social media, and mental health. Good evening and thanks for joining us. I'm Amy Avery.
And I'm Stephanie Hudson. Dr. Vivek Murthy he's pointing the finger at social media as the driving force behind the teen mental health crisis. A report released today calls attention to the concerns and it offers recommendations to fix it. I spoke with a mental health professional at CHKD where, like the rest of the nation, the number of teens in need of mental health care is soaring. Teens and smartphones go hand in hand, but according to the Surgeon General, constant scrolling is having a negative effect on their mental health. Dr. Samuel Scott sees it a lot in patients he treats at CHKD.
I see it a lot of times more as a reflection of the other symptoms that they're experiencing.
Depression and anxiety among teens are at an all-time high nationwide. At the same time, the Surgeon General's report shows up to 95% of teens say they are on social media almost constantly.
The impact of social media varies so much depending on what's actually going on.
Dr. Scott agrees with the report, which states while sometimes technology increases self-esteem and builds communities, other times it erodes self-worth.
It really varies so widely from person to person, what's supportive, what's harmful.
The report recommends more research and offers tips and resources for families.
One of the things that really stood out to me was that, really kind of modeling how to have a healthy relationship with social media. The solution isn't to just take away social media. It's not going anywhere.
It also includes recommendations for lawmakers to ensure we have strong safety standards and technology companies to be more transparent and create better tools to protect teens.
If you have questions or concerns about their social media use, the first step is to talk with them about it, find out what's going on, and if needed, seek professional help.
So, how old should a child be to use social media? Well, the report said there is no clear information, but Dr. Murthy believes that 13 is still too young. That 53-page report, which also addresses schools, healthcare providers, and community groups, has a lot of in-depth information, recommendations, and resources. You can read it with this report on wavy.com.